Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, welcome to 5 to Thrive Live, a podcast about thriving for those who have been affected by cancer and chronic disease. I'm Dr. Lisa Schuler, and I co-host this podcast with Carolyn Gazella. You can find all of our past shows on any major podcast outlet and a schedule on ithriveplan.com. And tonight I'm very excited to be talking with my colleague and friend, Dr. Dugald Seely. We're going to be talking about exercise and some new findings around exercise, some nuances, shall we say, about exercise, particularly within the realm of a cancer diagnosis. So we're going to learn about some of the latest research, and we're going to also get very practical and talk about some strategies. Dr. Dugald Seely is a naturopathic doctor who runs the Center for Health Innovation, a large multidisciplinary clinic in Ottawa. He's also the executive director for the Patterson Institute for Integrative Oncology Research with the Canadian College of Naturopathic Medicine. Dr. Seely has been awarded over $12 million in support of clinical and synthesis research and has published over 100 peer-reviewed papers and book chapters. Dr. Seely was a previous president with the Oncology Association of Naturopathic Physicians and a recipient of the esteemed and prestigious Dr. Rogers Prize. So he'll come and join us in just a sec. But before we start the conversation with Dr. Seely, I want to thank our sponsors. First, we have Immuse, a unique patented postbiotic that gives your immune system a key advantage. Immuse is an ingredient in many immune-supporting dietary supplements, so look for Immuse on the label or go to immusehealth.com for more information. Also, we thank Cognizin Citicoline, which helps your brain fire on all cylinders. So if you're looking for a way to enhance your brain's function, your memory, focus, and attention, look for Cognizin on the label or go to cognizin.com for more information. And we thank ProThrivers Wellness Supplements, including ProThrivers Wellness Sleep, a product that contains melatonin and other sleep-supporting nutrients, as well as ProThrivers Wellness Brain, which contains cognizin and some other brain-supporting nutrients and herbs. And finally, Dr. Ohhira's Probiotics, a best-selling probiotic for over 30 years with 12 probiotic strains, which are shelf-stable without refrigeration due to a unique 3-year fermentation process. And you can learn more at drohhiraprobiotics.com. Well, hello, Dugald. Welcome to 5 to Thrive Live.
Hi, Lise. Really great to be on with you again.
Indeed. And I'm excited to be talking about this because I have long said, well, it changes, but I would say pretty consistently, I've said if I was left with one strategy on my desert island for preventing cancer, it would be exercise. It kind of is in battle with stress release, but I think exercise is really, really important. And I think you do too. So let's start. What are some of the broad benefits of exercise? Like basically, why is it good for all of us?
Yeah, I'm totally with you on that. It's hard to think of something that isn't kind of improved by exercise. So as far as medicine goes, from a panacea standpoint, the exercise is probably one of the closest things to that. I think, we all know about exercise being beneficial, just like we know that eating our fruits and vegetables in particular are useful. So it kind of gets lost in that certainty that everyone knows, but I think that is a bit of a sad thing because it's just so potent in terms of its effects. But everything from cardiovascular disease risk, blood sugar management, diabetes, stroke risk, dementia risk, cancer risk, all kinds of things benefit from exercise, and in particular, just how we feel about our lives, I would say, and how we feel in general.
Yeah, I mean, that's kind of the amazing thing. It's hard for people who aren't, well, we're going to get to strategies for people who are having trouble starting a regular exercise routine. But once you start, you feel so much better and you're getting all those benefits, which is kind of unusual in terms of strategy. So that's a big plus. So what about cancer? Is there a specific cancer preventive effect from exercise? And maybe you can give us a little bit of nuance into this, like what kind of exercise is most beneficial and what type, what frequency, all that kind of stuff.
Yeah, so I think in terms of cancer risk prevention, the primary prevention piece, there's clearly benefits with respect to having a regularity of exercise to reduce the risk of most cancers. And, most of the big cancer types, breast, colorectal, lung, endometrial, even ovarian, they've been studied for this more so than the more rare cancers because they just inherently get more research. And there's clearly a preventative benefit by having physical activity to reduce the risk. And that may be up to about a third of a risk reduction from that standpoint. And then it sort of applies as well when we're looking at secondary prevention, the prevention of recurrence of risk of it coming back. There's some good growing evidence around the ability of exercise to reduce that. Most of this evidence is coming from observational studies, so there's some biases and there's some limitations with interpretation of that data. But just like we understood from observational data that smoking is a clear risk factor for cancer, and that's basically proven beyond a doubt without a randomized clinical trial, I think we're kind of at that same place when it comes to exercise now as well.
Mhm. And when you say exercise, like,
Yeah,
be more specific, if you will, because I think
right.
this is something that people, there's some confusion, partly because this all started with this 30 minutes of moderate pace walking 5 days a week. And that's kind of become the line or almost synonymous with exercise in terms of cancer prevention. But is that really the best? Or, tell us what you've learned.
Yeah, I think it's always relative to the person in terms of the benefits that they achieve. So someone who is pretty much sedentary, isn't doing very much, is maybe overweight or not either, but simply is not being very active, not even really walking much, then just walking a few times a week for short distances will make a huge difference for that person. So it's relative to the baseline of where the
Mhm.
person's coming at. But it seems that the recommendations are really landing as far as sort of optimal exercise levels between 150 and 300 minutes of moderate level activity. And that's kind of like, brisk walking, light jogging would be kind of considered moderate. Cycling, that would be swimming. Those are sort of moderate type exercises. When you start doing a little bit more high intensity activity where, it's longer distance running or higher speed running and or hiking in the hills with weights on or doing fast biking, that kind of thing, then the duration can be a little shorter because you're getting more intense exercise. So that's sort of in the aerobic exercise front. And then if we're looking at that's sort of more endurance type work, but which is really good as a base to get. And then the other really strong recommendation that's been coming in more and more is to incorporate resistance type work, weightlifting, or things that help with strength training, and to do that ideally at least a couple of times a week, where there's a bit more intensity and it's more focused on strength gain, and it's actually more beneficial from the bones in many ways too. So it's a mix of the endurance, but also and having that strength training too, and ideally at least getting 150 minutes. But you start to get even greater improvements right up to 300 minutes. Beyond that, it starts to plateau, it seems. But there's not really well, there is an upper limit, I guess, but most of us aren't really worried about that.
Right. Okay, good. So, that's helpful. basically the 150 minutes is equivalent to that half an hour walk 5 days a week. So that's continues to be a well-researched number. But the important thing you said is that it's up to 300. So more is actually better if people are in a place where they're fit enough to do that. And I think that's an important takeaway there. And what about, so we're talking about prevention. What about people who are already diagnosed and they're undergoing treatment? Give us a little bit of a synopsis in terms of the value of exercise during oncology treatment.
Yeah, there's pretty much every kind of cancer treatment that someone would be looking at, whether it's surgical, radiation therapy, chemotherapy, even targeted therapy and immunotherapy and hormonal therapy. All of these are going to respond. The body's probably going to respond better when exercise is part of the mix. And those effects can be quite interesting and different depending on the type of therapy. So for surgery, for example, people who are deconditioned prior to surgery, their outcomes are worse. And that is in terms of duration of the hospital stay, higher likelihood for adverse events during surgery, less more time to recover, and more immune depletion as well that can occur following that. So there seems to be that conditioning prior to surgery really prepares you more effectively for the surgery, leads you to have less bad outcomes from it. You do better, you recover better, and you lose less muscle mass after the surgery in the convalescence period, where that often can be the case. And that, I think, is an important aspect to consider. Long durations where you're sort of out and not able to be active has a real detrimental effect on muscle mass and long-term health. And that becomes particularly important as we get older as well. So getting conditioned prior to surgery, really wonderful opportunity to get that work started. And then after surgery to get sort of up and active, maybe not right at the same place that you were before, but moving quickly helps to reduce that sort of convalescence period.
Mm-hmm.
And then with chemotherapy, we know that people who have better fitness overall and are active have less dose reductions in their chemotherapy. They're able to tolerate the therapy with less side effects as well. And they usually go to completion of that therapy, leading to better outcomes. So it's there's so many benefits with the resilience factor that you get from fitness. Even things like chemo brain or cognitive dysfunction that can occur sometimes with chemotherapy seems to be improved with exercise as well. And so there's just in terms of how one feels through it, and then also the outcomes, those are improved as well. And
Mm-hmm.
and even survival from that treatment seems to be improved as well.
Yeah, I mean, it's just kind of doesn't end. So
Yeah.
really made a strong case for exercising to reduce the risk of cancer and its recurrence. You've made a case for continuing to exercise during treatment. Anything else you want to say about the value of exercise as a survival technique?
Yeah, again, it's not like all the types of cancer have been studied, but it seems that people, like in the comparison with the observational studies, there appears to be a range of risk reduction as far as mortality goes between like 25 to 70% for mortality due to the cancer. So, we're talking about big effect sizes as far as the cancer goes, and then even all-cause mortality or overall survival, which is our strongest outcome, is improved between 20 and 45% for all-cause mortality between the people that have the least level of activity versus the highest level of activity. So this has become a recommendation from virtually all of the major organizations, all the credible organizations that are involved in cancer control are recommending now exercise to be a core part of the routine, and a recommendation from the oncologist, in fact.
Mm-hmm. So let's get a little nerdy for a moment. And why? Why does exercise do all this? Like, what are some of the underlying mechanisms?
Yeah, there seems to be a lot of those, and I'm sure we're going to discover more and more related to that. But one of the aspects is metabolic. The effects of cancer, the effects of exercise and what it does to the metabolism. It seems to overall reduce inflammation in the system. It will improve insulin sensitivity, and for cancers that are responsive to more sugar in the circulation, more insulin-like growth factor, these kind of drivers of cancer growth in many cases. All of those seem to be attenuated and improved when you've got fitness, someone who's fit and is actively doing exercise. Just the very nature of exerting and moving your muscles has like an insulin-like effect on the muscles by causing the GLUT4 to migrate to the surface of the cell. That's the receptor that actually draws glucose out of the blood into the cell and into the muscle in this case. And that's what insulin will do. But there's no need for insulin. You just simply need to go for a walk after a meal, and that actually causes this effect to be there. So, it's a wonderful way to be motivated to go for a walk after the meal, as you know that you're going to drop your blood sugar pretty quickly and improve your overall insulin sensitivity and metabolic health. So that's a big one. Immune function seems to be improved. There seems to be an activation of natural killer cells. There's more activation of the T lymphocytes, that the immune cells that are involved in cancer control are moved through the circulation. They may even cause tumors that are considered to be sort of cold, if you will, or not immune active, to be a little bit more immune active, perhaps. So it's circulating things in the body and it causing greater activity from an immunosurveillance standpoint. And one other aspect that I find just super fascinating is the mechanical effects of exercise alone seems to have a destructive effect on circulating tumor cells, cancer cells in circulation, that may lead to metastases that can occur, which is what we really don't want with cancer. But by causing sort of higher blood pressure and higher flow of blood through the system, that has literally a destructive effect on these cells in circulation, possibly by removing things that cluster around them, like platelets or the clumping of these cells, but also literally by just simply having that destructive force. And that's been shown in vitro models, and it's been retested in vivo in humans, showing that there is that viability. These cells are reduced immediately post-exercise. So it's an interesting one. Hopefully we'll see more research on that. But to me, it's like, a direct anti-cancer therapy. You go for exercise, particularly when you get your blood flowing a little bit higher in more intensive exercise, you're having a direct toxic effect on cancer cells.
Yeah, it's kind of amazing. And that makes me think too, there's more and more research going around or coming up now around the timing of sort of the activity of tumors and when tumors are most active and when the immune system is most active. And there seems to be sort of a differential effect in terms of the timing of exercise. And I'm wondering if you and your research have come to any conclusions, because I've actually read the articles that state the very opposite. It's best exercise in the morning, and then I've read other research which says actually it's best exercise at night. So I'm wondering what you think.
Yeah, it's a good question. You kind of got me a little stumped on that because I don't have a good answer for you.
Yeah, well,
That
there's
shows
reason for that.
the depth of the inquiry. I love it. And I'm going to be looking into that a little bit more after. I don't know. I think, at the first level, I would say, I'm sure there probably are some circadian effects of the benefits of exercise at particular points, and maybe particularly around, say, radiation or chemotherapy, there may be some benefits there. I suspect there's variation between individuals. I'm sure there is going to be variation, but I think the first thing is to get people moving, and it's kind of like there's no bad time to do that.
Yeah.
And then and more kind of is usually better, but to be aware of your limitations and to do it in a way that motivates the self, and that I think is key, because it's not easy to exercise, especially if you're starting. It kind of feels hard, and it's not. So yeah, I'm going to save that for level 2.0, and we'll come back to
Okay, yeah, fair enough. I mean, you make a good point. Just like exercise, whenever you can do it, it's going to be beneficial. So there are some beliefs that certain people, though, actually should not exercise. It's been circulated around that, for example, people with cancer that spread into their bones, they have supposedly more brittle bones, so they shouldn't exercise. People with excessive weight loss or cachexia, or people with lymphedema. That's kind of a swelling of the lymph. So maybe just those three. What do you think?
Yeah, great. I'm glad you're asking the questions. So for the bony metastases, as the first one, there are risks with impact sports and with impact type exercises, but most of the exercise that we do are not impact. Although I would place that there is a real role for jumping, particularly for women, and for plyometrics, which causes some impact on the bones to help strengthen bones, in fact. But if one has, say, bony metastases that's clearly identified in the spine, or in a particular, peripheral, a bone in one of the limbs, then, I think some mindfulness around that makes sense, in terms of not causing undue stress to those bones. However, a progressive stress where you're putting in under weight, you're strengthening the muscles around the bones, and you're also strengthening the bones by putting pressure on it, is going to be beneficial even for someone with bony metastases. So it's certainly not a reason not to exercise, and it will improve all those parameters in the same way. Just have to be mindful about the type of exercise that one's doing, and I think getting some advice from a specialist may be helpful, and just working through a little bit of that. The lymphedema one is another concern that's sort of pushed people away from doing exercise, and I think to the detriment, because it really actually it seems to help lower the risk of lymphedema by being fit, by getting circulation through the limbs normally. If for someone with a breast resection and an axillary dissection where the lymph nodes have been removed from the underarm, and there's a higher risk for that arm lymphedema to really occur, then I think being mindful with like repetitive motions of the arm, that you can sort of build up the like a more pressure in the tissue, and therefore it might be a little bit harder to evacuate that or to drain that. So lifting the arm after the exercise may be one strategy, using compression garments may be another. Being mindful of the effect of the exercise on that swelling, and maybe even taking objective measurements of it. Again, possibly working with a lymphedema specialist who can get fitted for a compression arm. That's good. But if there's nothing there and you're doing something and you don't feel anything happening from a negative standpoint with the lymphedema, you're probably helping your risk of lymphedema. So good, I'd say, on that front. And then with the one for cachexia, and I think even overall, perhaps just the perception within cancer that we're maybe a little bit more fragile with a diagnosis, and we should be careful about what we do, and we should, rest more and all that. That's really counterproductive. And cachexia itself is a catabolic. It's a wasting process where, kind of our tissues are being lost internally, particularly lean muscle mass. And as lean muscle mass gets degraded, then it really has big detrimental effects on long-term outcomes, and just what quality of life, and so is not a great thing. But exercise counters that. Exercise is in fact anabolic. It'll cause the production of lean muscle mass. It will counter that effect. And I think being well nourished, particularly with protein and calories, while you're exercising and doing this activity, is really important. But it's the idea that you shouldn't exercise in a state of cachexia is actually counter productive.
Yeah. I mean, it's such an important clarification because I have quite a few patients who have lost weight, and even to the point where, they're considered perhaps more thin than they would like, but their lean body mass is actually okay, and they have the energy and the interest in exercising. So I think it's really important that those individuals continue to
Yeah.
be active, because it's really going to help their situation overall for sure.
Yeah. Right on.
Yeah. Okay. So let's motivate people to do this. So you've been studying this, and I'm sure you have this conversation with your patients quite often. So how do you what are some of your favorite strategies, tips, tricks to motivate people to exercise?
Yeah, so I really like to ask people what they like to do
Hmm.
from an exercise standpoint, because I think that's the best place to jump off from. And they can, bring back in something that they feel confident in their ability to do. And maybe it was something that they did in high school or in university or wherever, whenever as a hobby, and they've had an interest, but just simply lost the time and the interest in doing it for whatever reason. So if they can bring that back in, fantastic. Or adopt a new exercise that they've always kind of wanted to get into. Dancing is an amazing one. Good for
Mm,
balance, good for endurance work, and it's great for the brain. There's so many benefits, and you kind of don't feel like you're exercising.
yeah.
But so yeah, trying to find things that people like to do, and then to do it at a point, at a level that they feel confident to do, and then they can get gains by starting that. And I think really having them schedule it is just super important.
Yeah.
Yeah.
Yeah. Great idea. I mean, I kind of, there's so many books and strategies around habit building. And I think that you've identified a lot of those. And really, it is just a habit, which I think that helps people to hear that and to really let that sink in. The hardest part is starting the
Yeah.
routine. And once you're in it and that habit is formed, the feel good stuff happens, and it's just part of your routine. So it's much easier to stick with it. So it's just that initial hump that's challenging, which I get because people are tired. The last thing they want to do is exercise, but it's
Um,
important.
yeah, there's often pains at the beginning too. Like people will
Mm,
experience a little bit of setback, and I think to not be too discouraged by that, but again to get back um, on the routine, and not to be discouraged by that. So it's like, if you're someone's quitting smoking, they're going to do it maybe a few times before they successfully do so. So it can be a little bit choppy at the beginning. But yeah, it definitely, the habit, once it's there, really kind of self-supports that.
yeah. So in our last couple of minutes, I have two questions for you. One is, do you advise people to use trackers to, around their exercise, like
If
wearables and that kind of thing?
Yeah, if they like that. I mean, I personally love to look at my data for like running. I've gotten
Hmm.
it to be a bit of a, maybe too much so, but it's I think the things that help, so getting a pedometer for steps is a great one, trying to
Hmm.
achieve a certain number. So yeah, having these objective things can be, I think, helpful if but they have to be helpful.
Okay. All right. Yeah. Good. All right. Any final thoughts you'd like to leave around this topic?
Just be active.
Be
Yeah.
active. I like it.
Yeah.
Well, I'm with you on this. I think, this is a really critical strategy. And I think, you've made some really important points. One of which is that it's important for people to find something that they enjoy doing and they can continue to do. And there are so many different ways of exercising, and exercise can be a social activity. It can also be time to just be alone. It can be time out in nature. All of that has benefits for people. Um, and yeah, just getting that habit in place is so critical. I mean, I have to say, both of us, you and I have been longtime exercisers, and I get depressed if I don't exercise, if something prevents me for several days in a row. So,
Yeah.
there is danger. Danger, you will become addicted to your
That's
exercise.
right.
Okay, well, this has been a great show. Thank you, Dr. Seely, for taking time to join me tonight. So, where can our listeners find out more about you and your work? Can you have any website, social media you'd like to share?
Yeah, probably the best place actually, it's maybe a little old school, is the newsletter through the Center for Health Innovation, because we have we do a lot of webinars, and they're accessible, at no charge to anyone, really around the world. And so that's at the chi.ca, thechi.ca, and you can just sign up for the newsletter. And there's some resources through there as well. And I guess I have an Instagram handle at integrativedoc11. That's mine. I don't do a lot of posts on it though.
All right, good, great. Well, thank you, and thank you again for all that you do for naturopathic and natural healthcare, specifically in the realm of oncology. We owe much to you. And we also want to thank our sponsors, Immuse Postbiotic for enhanced immunity, Cognizin Citicoline to help enhance memory, focus, and attention, Dr. Ahir's Probiotics, award-winning pre- and probiotic formulas, and ProThrivers wellness supplements designed specifically for thrivers. And we want to thank you, listener, for joining us, and may you experience joy, laughter, love, and exercise. It's time to thrive, everyone. Have a great night.